Okay. Welcome to today's Fed Talk. This is part of our new monthly series featuring timely public health topics with the subject matter experts and public health professionals. Today's session is Check Your Colon, featuring Rhonda Andrews Ray. Rhonda is a veteran of public health, having served as an administrator to 3 different health departments over the past 27 years. She is currently the executive director for Southern 7 Health Department. Rhonda holds a master's degree from SIU Carbondale. In 2017, she served as the president for the Illinois Association of Public Health Administrators. In that same year, she won the Distinguished Public Health Employee Award from the Illinois Public Health Association for her work on the FIT program for local health departments. The best day of Rhonda's career, she says, was when a gentleman in overalls visited a flu clinic where she gave him a FIT kit that saved his life. And I will now turn it over to our presenters for the day, Rhonda Andrews.
Thank you. Thanks, Lainey. I really appreciate being invited to come speak, especially since this is the first of your TED Talk, Fed Talk that you're going to have. So I really appreciate the offer. And so today we're going to talk about checking your colon, which is the name of my presentation. So in the first screen, you see pictures of all kinds of employees that are wearing a check your colon shirt. And usually when you wear these in public, people will get the check your, but they don't get the colon. So they'll ask you what your shirt means, and then you tell them. And it's a good way to promote colorectal cancer awareness. So every month we do an awareness here at Southern 7, and we usually have a shirt that goes along with it. And of course, March is colorectal awareness. So these are our shirts. So if you want to move to the next screen. Okay, this is a picture of me and my husband, John Andrews, and it was probably taken about 2014. And you can tell he's got a little pump hanging out of his shirt, and because we were at a chemotherapy clinic. But how this story got started was back in the spring of 2013. John got to where he started just basically really not feeling well. He would have a lot of fatigue. He would fall asleep at weird places. Like I can remember one time he fell asleep at my child's t-ball game. So that, and it just seemed odd because he would never do things like that. And one time I had, he was at a funeral for my grandmother who had passed away. And after the end of the funeral, he laid down on the pew and was starting to fall asleep. So we'd take him to the doctor, and the doctor wouldn't give him any tests. They would give him antibiotics for different things, and which antibiotics never worked. And so it got to be fall. And in the fall, he developed a really weird cough. And he got to where he couldn't hardly even walk upstairs without having to stop and take a breath. So we got him to the doctor. The doctor did a chest x-ray to make sure he didn't have pneumonia, which he did not. And then they did some blood work. It was on a Friday. And they said, we'll call you on Monday with results. So they called us on Monday with the results and said his hemoglobin was extremely low. I think it was in the 5s. And he was losing blood somewhere. And we needed to get him a CT scan to figure out what the problem was. So we had an appointment that day with the first CT scan, and within about an hour and a half of getting that scan, the doctor called us back and said, I need you to come to the office. And my husband said, I really just need to lay here. I can't come in. Whatever you're going to tell us, tell us. So she had us on speakerphone, and she said, I need to tell you that you have colon cancer. They found a 4-inch tumor in your colon. It has spread to the lungs, which is why you're coughing, and it had also spread to the liver. And what she didn't tell us at the time was that the liver looked so bad, it looked like Swiss cheese. So he was in really bad shape by the time that they figured this out. So immediately went to the hospital. He had a blood transfusion, a colonoscopy, just a lot of workups done. And then within about a week, we were in chemotherapy. So we did chemotherapy for every 2 weeks for about a year and maybe a month. And he did several surgeries. They resected the colon. He had a special liver pump in, just a lot of different surgeries. And it started to get to where his liver was failing. Lainey, can you turn to the next screen, please? And so he would turn yellow. So this is a picture of him in July of 2009, big, robust guy, loved Elmo, loved people, And then we've got him January of 2016. This is about 3 weeks before he died. And I really wish this picture showed how truly yellow he was. Even though it looks frightening in the picture, he was worse than that. The yellow was in his eyes. His eyes were yellow. His tongue was yellow. His nail beds were yellow. And he eventually died on February 1st of 2016 from liver failure due to metastatic colorectal cancer. Can you switch screens? So after that happened, I had 3 boys that I had to take care of. My youngest was 11 at the time, and I was mad. I was sad. I was trying to make sense of why this had happened to us. And I'd worked in public health departments my whole life. We never talked about colorectal cancer, didn't even really know that much about it. And so I got an invitation, just a random invitation, to come to a colorectal cancer roundtable that was in the central part of the state. And it was in June after my husband had died in February. And so I thought, okay, I will go just because. And so I really didn't expect anything, but I went, and it was so interesting. There were a lot of really great speakers, and they talked about work that they were doing. One person worked for primary care centers, and she did work with a fit kit, which at the time I had absolutely no idea what a fit kit was. And so after it was over, I went up and talked to her for a while about these fit kits, and she said they were doing them in primary care centers. And I thought, well, if they're doing them in primary care centers, why in the world can't we do them in health departments? So I decided I probably needed to conduct some research. So I tried to figure out, first of all, where is the prevalence of colorectal cancer, which is what is on this slide. And we basically have 3 hot spots. We're in the lower Mississippi Delta hotspot, which, as you can see, goes right down the Mississippi River. And it's 16 counties in Illinois. And I always have people, when they look at this slide, say, why does it go right down the Mississippi River? Is it something that's in our water? And I wish I knew the answer to that question, but I just don't. The only thing that I can tell them is poor health outcomes follow the river as well. So anytime you see, poor outcomes, colorectal cancer, you will find it go right down the same path. Can you advance, Lainey? So after I talked to the girl about the fit kit at the meeting that I went to, I decided I would do a little bit more research. So I called the American Cancer Society, and I got hooked up with a couple of people there, and I got my hands on one of these to find out what it was. And I knew right away I didn't want it to take the chance to take the place of a colonoscopy, because colonoscopy is always the gold standard for colorectal care. Anytime you can get a person a colonoscopy, that is much better than getting them a fit kit, because a fit kit only tells about the presence of blood. It doesn't tell where that blood came from. So I got to look at the kit. I got to play around with it. I even used one just so I could see how it worked. Lainey, can you advance? And I decided that local health departments didn't know anything about this. But I knew an awful lot of the administrators, and I was pretty active in the association and went to the meetings. So I got with my American Cancer friends and some friends in public health, and I talked to IPHA and Center for Asian Health, and just a lot of people, even in Chicago. And we decided we would try to come up with a colorectal cancer prevention program, a FIT program that would work for public health departments. So I thought, okay, we got our papers together, we had done our research, we were ready to go. All I needed was some pilots to do this project. And I thought, if I get 5 projects, 5 pilots, I would be doing really good. So whenever I pitched it at one of our meetings, which we have about 94 counties and health districts at those meetings, I had, instead of 5, I had 42 say that they wanted to join on. And I was shocked that they wanted to do it, but we did it. We did 2 trainings, one in a northern part of the state and one in the southern part of the state. They got materials that went with those trainings to help show them how to talk to people with the fit kit. Here's what kind of papers that you can use. We had over 1,200 kits that were pledged from different counties because we asked them their goals. And we had regularly 19 counties that were doing fit kits. So can you advance, please? So some of our FIT goals, I'll read you some of the things we had on the screen. Each county would first of all give us a goal for the test that they wanted to perform. And this was back in 2017, between October 1st and June 30th of 2018. Then they would electronically submit a report to me by the 15th of each month after the end of the quarter so that I could gather all the data from that program. So we wanted the FIT kit return rate to be at or above 55% because the baseline was, without any kind of reminders, the return rates is 25% for county health departments in Michigan and 45% from the GE Foundation. But with reminder calls, FIT kits are approximately 60% returned. So then we wanted each county to commit to aiming for 80% of those that were positive to go ahead and get a follow-up colonoscopy. And then we wanted them to do that within 6 months. So next screen. So here's the data that we had, and this is October 1st of 2017 to March 31st of 2018. And I have Fayette County, which is the county that I worked in at the time. And then I had, this one happened to be six counties were not reporting, but was everything in Illinois, and it included Fayette County. So what we had in, and I'll just tell you Fayette County first, we did the most kits of any other county, which is, I had a lot of people working on it. So we had 154 kits, a 92% return rate, and the national average is anywhere from 7 to 12%. That's positivity. We had 39 that tested abnormal, or a 28% positivity rate. And like I said, the national average is 7 to 12. So we were 2.5 times what the positivity rate is for the country. We had about 60% of the patients go on and schedule a colonoscopy. We had 2 patients with adenomas, and we actually found 2 patients with stage 1 carcinoma. So how that compares to Illinois, Illinois had an 80% return rate on their tests with 23% positivity, so still well above the 7 to 12%. 51% of the patients received or scheduled a colonoscopy. 15 people had adenomas, and there were only 2 carcinomas in the state, and those 2 were in Fayette County, which was my county. Next screen. So here's my program success story, and here's why I said at the beginning that this was the best day in my career, because if you can accomplish this, I promise you it's the best day in your career. But I used to go out at flu clinics is when we would do these, and I would tell everybody that I saw, it's colorectal time. You need to think about your colonoscopies. And I would ask them if they had one. So this gentleman walked by, a pair of overalls. He looked like he had come off of his tractor. He was in there to get his flu shot. And so I looked at him and I said, "We're here promoting colorectal cancer." I said, "Have you had a colonoscopy?" And he said, "Nope, and I am never going to." And I said, "Okay." I said, "Are you willing to talk about another option?" And he said, "What's that?" So I talked to him about FIT. I told him that it wasn't a replacement for a colonoscopy and that he could, it's totally free. He could go home and he could take this test and he could either bring it back, mail it back, whatever he wanted, and we'd test it for the presence of blood. So he said, fine, he took it. And I turned around to the secretary that was beside me and I said, he won't bring that back. Just his attitude, you could just tell he wasn't going to bring it back, but he did. He sent it back in, and whenever we first did the test on it, it's a test strip that looks like a pregnancy test. And so if it's one test, that's your baseline, and then if there's 2 strips, then that means they're positive. Well, this guy was so positive, the ink kind of went in between the 2 lines and made one big, huge line. And I thought, this is defective. Something's wrong with this test. Let's test it again. So we got another test and the exact same thing happened. So, okay, obviously the guy's positive, really positive. So we called and talked to him, said, your test was abnormal, need you to go in and have go talk to your primary care doctor. We also called the primary care doctor, by the way, and talked to them and explained, what had happened. And so he did, he made an appointment. And he ended up getting a colonoscopy. And in the meantime, we found out he had an FOBT at the physician's office and it tested negative. So when he did the colonoscopy, they found so many polyps, there wasn't even a number of polyps on it, a 2.5-foot section of tubular adenoma. There was a stage 1 adenocarcinoma on top of some of the adenoma. So what they ended up doing was resecting him, and he had a follow-up in 6 months, no radiation and no chemotherapy. And this did not happen one time, it happened 2 times in Fayette County. So that is absolutely the best day in my life that his children did not have to attend his funeral, at least not at that point in time. So that was a wonderful thing. Next slide, please. So in between times, I had gotten remarried and my husband lived downstate. So we moved and I took a job with Southern 7 Health Department. And so that's why I have a job here. And so I knew right away that I wanted to set up doing some kind of colorectal work in the Southern 7, because that was one place on my map that we didn't have any work going on. So I did some research, which I always do, and I researched this time the region down here to see what kinds of barriers we would have. So if you can imagine a 2003 square foot area with only 65,000 people in it, you have the state of Delaware, because we're approximately the size of the state of Delaware. But Delaware's population is 9,067 people, whereas ours is 65. And then if you can imagine the state of Delaware having 1 Walmart, because in 7 counties we have 1 Walmart, 3 McDonald's, and 3 hospitals, of which none of them have labor and delivery, then you are welcome to the state of Southern Illinois. Because when you hear that there is nothing down here, I'm not telling you, I'm not kidding, there is nothing down here. So it's very barren and lots of different barriers that we had to cross. Next screen. So just a few, looking up colorectal cancer data for our counties down here. Alexander County had the highest colorectal incidence rate, which is about 53.7% higher than the US rate. And it's also number 6 on the list of top incidents in Illinois. Late stage diagnosis, Johnson County had the highest late stage diagnosis, which was 29.3% higher than the US rate. And Johnson County also had the highest death rate, which it was 30.8% higher than the US rate. Next screen. So I tried to figure out how many people weren't screened down here. How could I figure that out? And I used the census data, which listed people that were age 65 and older. So this chart is only for people that are age 65 and older. So I put their population in each county. Then I put the percentage of the population that was 65 and older that would calculate for me how many people there are out there. And then I went to CDC to try to find out how many people had been screened. So that's the 4th row you have on here. So then I just did simple subtraction, and that told me how many people were not screened, and then converted that to numbers. And by the time I was done, it looked like 5,300 people to 7,500 people in Southern Illinois had not been screened. So clearly lots of work to do down here. Next screen. So the first thing we did was we set up a flyer to advertise our program, and it's just very basic. It listed all of our sites, what a fit was, how to get a fit, what the colorectal hotspots were, some of the signs and symptoms, just that kind of thing. Next screen. This is a mailer that we did, a bulk mailer. These worked exceedingly well during COVID. We sent them out. You can send them out by zip code, by town, by county. You can set them up in lots of different ways. But we created our own, and we had them inserted into the papers so that when people read their papers, either that or the little trade magazines that they get that's free, we had that done as well, so that they would come in, and had a lot of people call to get a fit kit that way. Next screen. So here's some strategies. So there's, everybody knows we're understaffed. Okay, there's always a problem. There isn't enough staff to do these things. And my first suggestion would be find somebody that's mad about colon cancer, and they are out there. I was one of them. So find somebody that's family has been affected by colorectal cancer and ask them if they would like to help you get on board and do some work so that this disease doesn't, keep ravaging our nation. So that's the first thing I would recommend, but there's all kinds of other strategies once you have some people in place to do, and you'll see some pictures of them. And I have a list down the side. So these were, where do I find the people to test? The first thing we did was at our own office, anybody that came in that was over the age of 50, they would take like a bright pink Post-it note and they would put it on their paperwork. And then whenever the paperwork went to the nurse, that would clue the nurse into, these people are over 50. I need to talk to them about a fit kit. And that worked pretty well. We also went out to flu clinics and talked to every single person that got a flu shot, also got a talk about colorectal cancer and fit kits. And we did flu clinics at senior meal sites. We did them at factories. We also did fit clinics at factories, and we had another service with it. It was either a flu test or a flu shot. It could have been a tetanus shot. It could have been whatever. We worked with a lot of home health agencies and set up some MOUs with them that they would talk to their patients about fit kits and colorectal screening. We had some physician referral prescription pads, and I think on the next screen, I've got a picture of those. Did lots of social media and newspapers. If you see at the bottom, we did another shirt that says, ask me about fit. And believe it or not, whenever they see you out, they will ask you what that is. They think it's an exercise program, of course. And when you explain to them it's colorectal, it's an interesting situation. But we did those. There were some Amazon card giveaways, and we put a really neat sign on the back of our local bus service. And I've got a picture of that too. Next slide. Okay, so the first picture that's on here is you can win a $50 gift card. We drew those once a month for people who decided that they wanted to do a fit kit and they returned a fit kit. So several of those were done. They come up with a fit crossword puzzle for people. And then the last thing is the prescription pad. This was our prescription pad. We give these out to the doctors at the medical society meetings, and we ask them if anybody won't get a colonoscopy, if they will talk to them about a fit kit and send one of these sheets home with them and tell them how they can get one from one of our clinics. Next screen. This is the keep rolling, check your colon. These were the signs that are on the back of our ads or our buses that are here in this part of the state, and I love them. Because anytime you see people on public transportation, which it's not like we have a lot of it, but we have a little of it. And one of these is on the back of each of their buses. So that's wonderful. And then we had other swag. We had our shirts, we had back scratchers, we had pens and sunglasses, and the little orange disc is to help you open bottles. So old people love those bottle openers, and it says on it, it's for colorectal cancer screening and to get your screen. Next slide. So this is a strolling through the colon event that we had on October 4th of 2019. You can see us all gathered around. We had a mayor do a proclamation. He answered questions. We had a doctor, he's a surgeon, came and did a talk about colorectal cancer. We distributed some kits, which is another picture you can see down at the bottom. And then we had the 20-foot inflatable colon, which people could walk through, and it shows you polyps and malignancies and what those things look like. And it went very well. It's a very unusual thing when you drive through town, you see this big inflatable pink and you don't even know it's a colon. It's a pink thing, and the kids always think it's a bouncy thing. So next screen, please. So this is one that we did in Polk County. Same thing, just a different county. And this was as we were setting up. They were running it in conjunction with a 5K. So we had that up and had everybody to come to that. Next screen. And then in 2 days, I guess it will be 2 days, this Saturday, we're doing a Massac County strolling through the colon, and it's going to be at Big John's, which is the biggest grocery store in Metropolis, from 10 to 12. So we're going to give coupon deli sandwiches for anybody who takes a kit. We're also going to have some other services there, like COVID vaccinations. We're going to do some Narcan distribution, and we've got rural health. I think there's 2 rural healths that are going to come set up and do some other services. So sort of like a mini health fair with the strolling through the colon. Next, please. Okay, so this lists our data that we've had after all of these interventions and strategies, which we get to strategizing more and bigger all the time. So at the beginning, it's not too impressive, but at the end, we're starting to get there. So September of 2019 through March of 2020, we distributed 73 kits. We did have a 92% return rate, which is a nice return rate. 19 of those tested abnormal, so 28%, which is again above our 7 to 12% positivity rate. 8 of those people had colonoscopies. 5 of those did come back with adenomas. Then October 1 of 2020 to June 30th of 2021, we tested 133, so we're going up. 98% of those returned, or 98 of them returned with a 71% return rate, which is a little low. And I like to think it's because of COVID, because boy, we sure did try to get them back in, but it was just harder dealing with COVID and you couldn't actually talk to people. 18 of those did test abnormal, so 19.1% positivity rate. 12 of them, however, did get in and get a colonoscopy, so that was really good. We had about a 66% of those patients got a colonoscopy. 3 of them had adenomas. And then our last column on here is July 1, 2021. It's really through current. I mean, I wrote this slide on February the 8th, but this is an ongoing project. So right now you see 120 was distributed as of that date. If I went and looked at the data today, it would be different. But as of then, it was 58% return rate because the project's still going. So same thing, 12 patients tested abnormal, 17.4 positivity rate. At the time, 3 of them had received or scheduled colonoscopies, and I happen to know there's a lot more of those now that have at least been scheduled. And there was 2 adenomas. So as you can tell down here, we have found no carcinoma, but plenty of adenomas and plenty of patients that were told to come back in 3 years as opposed to 10 years. Next slide, please. Oh. There you go. So I guess in ending, I would say I just want to thank, I owe all this work really to my husband, John, and he would have loved to have been part of this. He always wanted to have new things, any type of genetic testing or anything, he would do it. So I owe all that work to him, and I thank everyone that has helped me to get this far with this project. So. And that's all that I have. Thank you so much for being on.
Thank you, Rhonda. I'm going to actually share my screen again. I think we cut your contact slide short. So let me share that real quick in case people need that.
Yeah, and if anybody has any questions or wants to contact me or anything, feel free to call me or send me an email. I'd be happy to talk to you.
Are there any questions for Rhonda? Feel free to, you can unmute yourself or ask them in the chat. Josh, I see your hand raised there. You can go ahead and unmute.
Yeah, I was just wondering, I missed a little bit at the start, but what's a good way to, what are good indicators besides being near the Mississippi for whether your community would have potentially a lot of undiagnosed people with colon issues? Would be a good way to, try to figure out if this is something to pursue for the community.
Yeah, I have several communities that are older, more senior citizens than some communities that have less senior citizens. And it seems like your colorectal rates will go where you have more older people. And if you have poor health outcomes in general, that's another one that colorectal cancer usually fits right into, which is all of Southern 7. So if you're a predominantly rural community with good health outcomes, lots of exercise, lots of fit people, little obesity and that kind of thing, it's probably not a real going concern for you. But if you're in a place that is has obesity, smoking, poor health outcomes, lots of senior citizens, that's just a hotbed for colorectal cancer.
Okay, Mariella, I see your hand too.
Hi, Rhonda.
Hello.
Just thank you for that information. It's very informative. I just wanted to know, how do I access one of those kits? Like, for example, I'm in the state of Illinois.
Yes.
How would I access one of those kits?
My information is on the last screen. Send me an email.
Okay,
Okay,
thank you.
you're welcome.
Are there other questions? Okay. Well, Rhonda, we appreciate your time and your presentation today. This presentation was recorded and will be available on the IPHA YouTube channel. So we'll send out a notification to our members when that is available. And our next IPHA Fed Talk will be on April 21st at noon, and it is on pandemic nursing and burnout.
Thank you, Lainey. Thanks, everyone.
Rhonda.
Thank you.